Good afternoon, and thanks for joining us for today's Healthline 3. I'm Courtney Butts, and Healthline is a 30-minute conversation where we like to focus on ways to help you live a healthier, happier, and pain-free life. We'll be taking your calls and answering any questions that you have live in the studio today. Those phone lines aren't open just yet. Give us about 5 minutes, and we'll open those. And as a reminder, if you're tuning in on your TV, turn your TV all the way down so that we don't get any feedback and we can clearly hear your question. That number to call is 318-219-4569. And joining us for today's conversation are not one, but two doctors, Katharine Balbuena and Wade Wyckoff with Willis-Knighton Rehabilitation Institute. Thank you both for being here today.
Thanks for having us.
Thank you so much.
Yes, happy to have you guys, and happy to learn a little bit more about rehab and rehab in the inpatient setting, since that's something that you guys specialize in. So tell us a little bit about first what you do, Dr. B.
Yeah, we really are so happy to have this opportunity to tell everyone about what we do, because we're so passionate about what we do. But we are both physiatrists, so we're specialists in physical medicine and rehabilitation, which means we are medical doctors. We did go to medical school, and we went to a 4-year residency where we trained in various areas of medicine, including orthopedics, neurosurgery, neurology, pediatrics, orthotics, a lot of different areas, so that we could become competent at taking care of patients that needed help after an injury, or for whatever reason they just couldn't do something the way they used to do it before. And so Dr. Wyckoff and I, and this is my new partner, Dr. Wyckoff, I'm so pleased to have him. We're kind of introducing him today.
Awesome.
I have been with Willis-Knighton since 2017, and Willis-Knighton has always had a physiatrist-directed inpatient rehab since its inception in the 80s. So we stand alone in that. Now we have 2 rehab doctors directing the care, which I feel is a really important distinction that we can share with everybody. Essentially, after our training, we have both decided to concentrate our efforts in the hospital inpatient rehab setting. So even though we do have outpatient rehab at Willis-Knighton, and we do refer patients to that, that's how we have decided to care for our patients, and that's how we impact their lives. We feel the most direct way.
Right. Yeah. And thanks for explaining that, because I think a lot of times people immediately think outpatient rehab, or maybe a rehab facility.
And that's still important.
Right.
It's an important progression, and we just help the patients get to that progression. But right after a surgery or after an accident, they're just not ready to even go home.
Right.
There are a lot of issues, and Dr. Wyckoff can talk about those specific issues that we see every day.
Absolutely,
that we help patients with.
Yeah. So you're new to the practice, Dr. Wyckoff, or
So
how?
I started in October.
Oh wow!
So I'm about
Congrats.
2 months in. I'm loving it so far. The staff has been fantastic. I was actually previously in Pensacola where I did my residency, and I would say our system is function. We're trying to help improve a patient's function is our goal. So we do, for our residency training, a lot of sports medicine, pain medicine, also inpatient rehab, which is what we're currently doing at Willis-Knighton.
Okay. Nice. Okay. And so you guys both are obviously very passionate about what you do, but why did you choose to be a physiatrist? Like, what drew you in? If you want to start, this is something, I guess, you're still fresh.
Yeah, it's a great question. So first off, my mom, she was a physical therapist, so I think she kind of gave me that thought of it's important to stay active. Your function is everything. If you don't have function, you really don't have a whole lot. And also just seeing patients in the hospital through my rotations, I noticed the benefits they would get with therapy, with rehab, and I did a rotation with inpatient rehab, and it was awesome to me to see them coming in, when they're requiring a lot of assistance, and then kind of each day they start to progress slowly, and then when they're discharging, just seeing how much they improved. And I felt like that was the most gains I would see for these patients was in the inpatient rehab.
Yeah, because you see them, I guess, every day, right?
Yes.
And we develop a great relationship. That's another reason I love it. I feel like I get to really know my patients. I get to know what their job was like, what their home environment was like, what their interests are. So we form a really deep connection with our patients.
I love that. And what about you, Dr. B?
And that's unique right now in healthcare, because healthcare is very rush, and we have that opportunity to really, like Dr. Wyckoff said, to know our patients and be invested in not just what's happening to them today, but what's going to happen to them in a week from now or 2 weeks from now. And we involve the families. So it's really, a wonderful environment. It's very positive. It's very give back. It's feel good. And we just have an amazing team. It's not just us. We feel that we're a very important part of the recovery process because we assist in pain management. We assist in medication management. We do a lot of education. We're very focused on that at Willis-Knighton, I think across the board, but especially in the rehab setting.
Yeah.
You can't learn enough about what has happened to you, and that's where we come in. And I think patients leave rehab so much better than they came to rehab. And we are very, it's very important for us to support the patient, not just physically, but spiritually, emotionally, and all aspects of their care.
Absolutely, yeah. And you have to, be invested in that patient because you're watching them go from something maybe that was very debilitating,
Oh, yes.
and then graduating in a way.
And they
I'm
do
sure
graduate. They
yeah.
get graduation
Oh,
shirts,
cool.
and we, it's a special place. There's nowhere else in healthcare that feels like inpatient rehab, and everybody feels that when they come in the building. It's just different.
I
and
love
it's
that.
very supportive.
Very cool. Okay, so tell us, what you see. We talked a little bit about it in the midday newscast. You mentioned maybe stroke, or maybe even after a bad accident, or even a surgery. So I'm sure there's a variety of different things, and that's why you kind of mentioned that you have to be, on it, as a provider to know how to treat these different patients. So what are the most common ones that you see at the rehab?
Yeah, so hip fractures are very common, and there's some complications that we have to watch out for. A lot of times they might be coming in with a lot of pain after their surgery, so we'll adjust their pain medications. A lot of them have to deal with constipation after, not only because of the surgery and the limited mobility, but also being on pain medications. So we'll help, treat their constipation. And watch out for other complications like UTIs and things like that, review their medications like Dr. Balbuena said. But basically, there's a wide range of diagnoses we'll see. We'll get a lot of stroke patients over at Willis-Knighton Rehab. We'll get a lot of just, debility is what we call it. Maybe they had sepsis in the hospital and now they're functionally declined to where they need some rehab to get them back home safely. So the diagnosis that we were looking for is any kind of diagnosis where they had a change in their functional status, and we think that they're going to be a good candidate for inpatient rehab.
Okay, makes sense. And I'm sure that the stay can vary, how long they stay in the inpatient.
It can. And there is we have a liaison team that will meet you where you are in the acute care setting and assess what you need and how we can best serve you, whether it be in the Willis-Knighton system or not. But we're hoping that if anybody needs us, if anybody is in that situation, whether it be a hip fracture or a debilitating change in their function, that they just give us a call. Just go ahead and call our liaison office. They'll send someone to you and discuss your options. Sometimes that is limited by insurances these days, but it's definitely worth a phone call. And we're there. You can come have a tour if you'd like, just to come see the building. We're located in the old doctor's hospital, so most people remember what that building used to be, but on Line Avenue, so right by the interstate. But it's a beautiful new facility. We just love being there every day, just to feel a good place. So
I love that. Yeah, and like you said, patients can be their own advocate of, making that phone call if they think that's something that they need.
That's so important, saying you're advocate, because patients have a choice, and when you are receiving care in a hospital, you do have a choice, and we hope that everyone would choose Willis-Knighton, or at least look at us when they're making that choice, and consider us.
Absolutely. Well, I can't even believe it's almost 10 minutes past 12, and so that means the phone lines are open. It's 318-219-4569. If you have a question for Dr. Balbuena or Dr. Wyckoff, you can give us a call right now. And we're talking specifically about rehabilitation, when you'd maybe want to see a rehab doctor, or, inpatient or outpatient, and how you can, be a part of that. If you have a specific question, give us a call. Okay, so we've talked a lot about the hip fractures and like stroke. So maybe talking more specifically from that orthopedic standpoint, what is your goals, I guess, for these patients? I'm sure it can vary a little bit, but in a general sense, what are you looking for?
Yeah, so I like to know what caused the hip fracture.
Okay.
Did they have a fall because they were having balance issues before? Is their home environment not safe to where there's a lot of clutter? Or let's say there's not a nightlight from the bedroom to the bathroom and they fell because it was dark. So I like to figure out what exactly caused that hip fracture so we can prevent it in the future. So we'll look at the patient's home environment. Also, with the hip fracture, it's good to be screened for osteoporosis. And if you have osteoporosis, in order to follow up with your primary care, in order to get the proper treatment for that. And I would say, also just reviewing their medications is important. They might be on some medications that can make patients drowsy or sedated that can cause hip fractures. So I like to kind of figure out what caused it, how can we prevent it? Because after a hip fracture, the mortality rate really can increase. It's very serious. So I'd like to prevent them from coming to see us again. I like seeing them in the rehab, but I'd rather see them outside Shreveport somewhere else.
Right, and tell them I'm doing great.
Yeah, exactly.
That's such a good point. And you bring up like activities of daily living, and are you also working hand in hand with like occupational therapists and physical therapists, and kind of talk about that dynamic?
Yeah.
Yes.
Our team is
so
very large.
It's a huge team. So I'll just name So we have
go
occupational therapy. They work on activities of daily living. What are those? It can be like bathing, dressing, hygiene, toileting, just the activities that you would normally do every day. So they help patients progress and the amount of assistance they need for that. Then we have physical therapy. They'll work more on like the patient's mobility. As far as mobility, are they using an assistive device to walk? If so, how much assistance are they requiring with that? And then we have a nutritionist as well. We have a wound care nurse. We have registered nurses as well that will be following the patient. We have the physical med and rehab doctors such as Dr. Balbuena and myself. Internal medicine, which they will help with more of the medically complex patients as well. We have social workers as well. And I feel like we probably have a couple more people as well.
Case managers.
Case managers.
Okay.
But every person is so crucial in order to
Everyone is
improving.
important.
Yeah, they play such a significant role in improving their function. So it's a beautiful team approach here.
Right. Yeah, and I think that that's so important for patients to realize that they have this army of people helping them, and they should hopefully feel very supported when they're in this environment.
And we do encourage families to come. A lot of other rehabs won't let the families in the gym. We have families in the gym all day long.
Okay,
So we think that's a really important part of recovery. So the family unit is staying together, they're seeing what's happening. And then we do a lot of training, we do a lot of education with the family because they're the ones that are going to be taking over after they leave. And these days in rehab, we just don't have as long of a time that we used to have. When I was a younger doctor, we had months of time to get somebody home. Now we have a few weeks, and that's a huge difference. And so everything that we can do every day counts. We tell our patients that, we have to push you. They do have to do 3 hours of therapy a day.
Wow,
so it's all spread out throughout the day, so it's not all at once, but it keeps everybody active, and it's what you need. It's what you need to get better.
Right.
So
would you say that the time constraints due to insurance coverage?
Largely, yes.
Yeah, unfortunately.
It's made us work harder, and it's amazing. If you had asked me 20 years ago, I would have said no, that's impossible. But the techniques have gotten better, and we have just amazing therapists. We just have such an incredible team, and they get the patients to do things they don't even think they can do, and it's a wonderful place.
It's probably, I'm sure patients are like, they love / dislike you. It's at the same time like, are you really asking me to do this right now? But then I'm sure
that would be the physical therapist.
Okay,
yes. They're the ones
They
that
give them
inflict a bit of pain. But that's where we come in, you know,
Yeah,
because
yeah.
we're really helping the patient be able to do their 3 hours comfortably and not suffering. So it's
Right.
an important team. We all work together.
And then they're probably surprised at what they can do too.
They
and then
are.
it's
They really
inspiring.
are
Yeah.
at the end. And I also forgot to mention speech therapy as well.
Oh, okay, yeah.
And they're important as far as for swallowing issues the patients may have, speech or language issues, and then also cognition. So I want to make
Right.
sure to give them some credit as
Shout
well
out.
because they play a huge part.
Absolutely. Yeah. So you mentioned a gym. So kind of talk about the setup at y'all's location and what patients can expect on a typical day to day, you know, whether that's from the pain management standpoint to going to the gym to do some exercises.
Right.
Yeah.
So from the time the patient's admitted, usually the first thing they're going to do is meet their occupational therapist that first morning. And they typically haven't had a shower in a week. And that's a wonderful thing to do.
Yeah,
So they meet occupational therapy, get dressed and ready for their day, and then they would be taken down to the gym, PT gym, which is a huge gym with floor-to-ceiling glass. So we get a lot of light therapy in that space. And it's just a way to start healing, you know, because patients don't even want to go back to their room if they're in between therapy. They just prefer to
Sit
stay
there.
near the window and get some therapy that way, some light
Yeah.
therapy. But that's how we get started. And then therapy can range every day, can start at a different time, but it's the 3 hours. It's a very strict rule that we must follow. We do follow Medicare guidelines and adhere to those. But patients just start getting better. We do therapy usually at least one day on the weekend, but we do have to do 5 consecutive days of therapy. Yeah, we see great results. So
I love it. Yes. Okay. And so, going back to that word, the physiatrist, can you explain, like, decode it for us? Like, what does that mean, and how does that make you different, maybe from you know, different specialties?
Yeah,
Go
so
ahead.
you know, physiatrist or physical med rehab is another word for us. But I would say, you know, our system is function, and we
Yeah.
take a whole body approach. You know, also mentally with the patient after having, you know, maybe a new stroke. You know, there's a huge psychological component as well. So our goal is really just to help them improve functionally, is the way I look at it. So when they're in therapy and let's say something's going on to where they're not doing as well with therapy, that's my job to figure out what's going on, how can I help improve things, and help the patient get the most out of the therapy. Basically, I want them to get the most out of their 3 hours of therapy a day is my goal.
Makes sense. So it's kind of like physiology and psychiatry, kind of, or I'm just kind of like, no, maybe
we
not.
overlap. That's the thing that's interesting about rehab is
Yeah.
we overlap so many other specialties.
Okay.
But we do face a lot of adjustment level depression, not so much major depression, but everybody is coping
Right.
in a different way with what has happened. It's usually a very traumatic thing, like a hip fracture, and you know, it's sometimes very, very difficult for patients to just kind of see the hope and see the next day coming, and that's where it's nice to help in that we do have psychiatry available for consultation if necessary, and we need that sometimes. We're very, I would say that we're very aware of our patients, not just their physical needs, but their emotional health as well.
For sure,
We
yeah.
definitely take that into consideration.
Okay. Yeah. And what about for stroke patients? You know, this is something that's pretty common and can be very debilitating, or it's just a big range, you know, of how it can affect a person. So, you know, how are you managing those things that they need, as far as like the mentally the things that they need, and then also just physically? So how do you manage that for those patients? If you want to.
So physically, you know, working with therapy as, you know, to improve their muscle activation and improve their balance and their strength. You know, speech therapy if they're having any language issues, which it could be an issue getting the words out, which is more of like an expressive issue, or it could be more of a receptive language issue as well. And for me, you know, I always try and give patients as much time as they need when I talk to them. I feel like it helps just for someone to listen to them and understand what they're going through. And I like to get the family involved as well. I think when everyone's on the same page, it really improves their, their outcomes. So I like to let them know if I'm going to change anything as far as medication wise, and just keep them up to date and explain to them, this is what you have going on and this is what we're doing about it. And for our stroke patients, we talk about preventing the next stroke. So we talk to them about blood pressure management. If they are a smoker, tobacco cessation is important to prevent another stroke. And we, cholesterol medication as well. So we talk about preventing another stroke, and we have stroke videos as well for the patients to review for that.
Nice. Yeah. So like you said, lots of education,
Mm-hmm.
and it's kind of different than like when you are in maybe in the acute care setting, you may not get like as
true.
much. Yeah.
That's true. There's just not the time
Right.
anymore. And we are CARF certified, which is the Commission for the Accreditation of Rehab Facilities. We've been CARF certified at Willis-Knighton since the 80s.
Nice.
It's an elective, higher level of accreditation that we have subjected ourselves to, but are really proud that we have this distinction. We also hold a stroke certification distinction as well. And we're the only CARF accredited rehab facility north of New Orleans.
Nice.
So it's not something that everybody does because it's a lot of work, but it does raise our standards. It's very patient-centered, patient-focused, where the patient, everything about the patient, how they interact with their family, their environment when they go home, they want to make sure that we're optimizing every aspect of that patient's recovery, even into the home setting, to make sure they have the proper support group, they have the proper assistance for the caregivers. We're really believe in caregiver support because we know the burden on caregivers is so high. So we work really, really hard at reducing caregiver burden before they go home and educating, you know, so that they know what they're getting into. We can help them.
Well, setting those expectations, I think, are so important, especially for caregivers. It's Caregiver, I think, Awareness Month this month, and so, and especially during, I'm sure, the holidays, there's maybe more, strain on those caregivers.
It's very, very stressful, and so, anything that we can do to help. That's why we have great social workers, we have great nurses, we do so much education and training because they may have never had to lift a patient before. And now they have to lift the patient every time they have to get out of bed. And there's good ways to do it, and there's also not so good ways to do it. So that's where the team approach really comes in. And having the families there.
Yeah,
so we can practice. And then we can also do home visits if that's necessary too, just to evaluate the areas at home that may be challenging for them.
Right, yeah, because you don't want to see a caregiver in the rehab because of taking care of, I mean, I'm sure it happens.
Well, it has happened actually. We've had caregivers have a stroke while their family member was in rehab, and then we kind of brought them in together. It does happen, and stress is, you've talked about that before, but it's a big impact. On all of our patients and kind of our daily lives now. So
absolutely. Okay, so how have you personally seen the rehab change since you've been there since 2017?
Oh, we have changed for the good. We've become more cohesive, I think, as a team in terms of our communication. And all the things that are important to help deliver care to the patient, we've intensified and gotten better. And we're always striving. That's one thing about Willis-Knighton. We're always trying to challenge ourselves to be better at what we're doing. We're even doing a new communication incentive right now, hospital-wide, and we're part of it. But I mean, we do these things every day. But I think that shows we're a little different. We're setting the bar really high at Willis-Knighton, and you can tell. Compared to other folks. So.
Love it. Okay, so with these patients, I just had a thought and I just lost it. Let me think. It's okay, we'll come back to it. Going back to you, Dr. Wyckoff, since this is your second month in practice, I guess, what are you, maybe kind of looking more towards the future, what are you kind of hoping to see happen at Willis-Knighton or just in your field?
So I'm hoping, we can continue to expand the rehab, continue improving, patient care, and just continue living up to what Willis Knighton was doing before. I mean, things were in really good hands with Dr. Balbuena when I came here. And, she was the only physiatrist in Shreveport as far as doing inpatient rehab. And now we have 2 physiatrists, which I think makes Willis Knighton's rehab stand out compared to the other rehabs, is that the other rehabs don't have a PM&R trained physiatrist. So I think, my goal is to help the rehab expand, help to make patients more aware about us, and provide services for them.
Gotcha. Okay, I remembered my question. So there's a cardiac rehab, and then there's this. Is there a difference between the specialty of, cardiac rehab? That's maybe an outpatient.
Right.
Okay.
So that's a specialized post-cardiac event. So either open heart surgery or heart attack. We see heart patients in the inpatient rehab setting, and they do receive therapy, but it's not considered outpatient cardiac rehab, which is a very holistic, intensive program which is monitored with telemetry. It focuses on nutrition, but it's a monitored exercise program when the patients have recovered about 2 months from their event.
Okay.
So we're in the acute phase where we actually, that would be too much for the patient. It would be too stressful. There's too many precautions right now that don't allow patients really to do anything. We're sort of holding them back from doing their normal activities and educating them how to do that. But it's a very important part of rehab. And we encourage all of our cardiac patients to consider it because it's 2 months down the road. But it does improve survival. It has been shown to do that, so most insurances will pay for that. It's usually about an 8-week program. It's outpatient. We do have one at Willis Knighton Bossier and at Willis Knighton North now, so we're really happy to have 2 locations. And that is a really wonderful thing.
So when they see you guys, it's like a stepping stone.
Right.
From the acute setting and then inpatient, if they need it. Sometimes maybe they are well enough to go maybe straight to the outpatient. Okay, got it. Makes sense. Okay, so tell us about some of those receiving areas. Like, where are you receiving some of your patients from? Like, where are they coming from a lot of times?
So, of course, we receive patients from Willis Knighton, but we receive patients from the whole tri-state area. We receive some from Dallas, Texas, from Arkansas, from Natchitoches, from Alexandria, sometimes from New Orleans. But we receive patients from anywhere. So if you're at another hospital, you don't have to be at Willis Knighton to come to Willis Knighton Rehab. So we do have a big team. We meet every day. It's a big team of nurses and therapists that evaluate the patients. So if they're ready to come and they meet criteria, then we help get them over to our building.
Okay, easy enough. And a lot of times maybe they're getting those referrals from doctors, that think that, or they, find that they need this kind of care.
Right, you can just talk to your social worker that's taking care of your family member and just ask them, hey, we're interested in inpatient rehab. Can you help us? And they should be able to help you, provide a list, and then if they call us, we'll come in and see them.
All right, good deal. Well, if someone is interested in, like we said at the beginning, being their own advocate, you mentioned a liaison phone number. Do you have that phone number?
I think we have that phone number. Was it going to be broadcasted?
If not, we can probably look up Willis Knighton Rehabilitation Institute. Is that what?
Right. So yes, that would be 212-4545 is just our general number.
Okay.
But yes, if you just call Willis Knighton Rehab, we'll direct you where you need to go.
Easy enough. Okay. And can kind of go over some of those diagnoses that patients would need to have in order to be considered for inpatient rehab before we go.
Want to talk about that?
Yeah, so a lot of times we'll look for like rehab diagnosis, which can be like a stroke, some kind of neurological insult, maybe something like Guillain-Barré syndrome. But there's a lot of different diagnoses we'll look at. It can be outside the rehab diagnosis if we think they qualify for inpatient rehab. So a lot of it will depend on the type of insurance the patient has. And then we'll review with our team to see if we feel like it's a good fit for our rehab.
Okay, so it doesn't hurt to ask.
Definitely.
Right? Or,
definitely.
call and make sure.
Definitely.
Okay, well, good deal. If where do you guys have a website that somebody could look up a little bit more information?
We're located on the Willis-Knighton website, so if they just click the rehab tab, they'll see patient testimonials. They can read more about us.
And remind us where you're located.
We're at 1111 Line Avenue, Old
Easy to
Doctors
remember.
Hospital. Yeah, it's a very easy one to remember. So.
Okay, good deal. Well, thank you both, Dr. Balbuena and Dr. Wyckoff, for being here.
Thank
Learned
you.
a lot about rehab today, and hope you did too. And this will also be on our website. That's ktbs.com/podcast, or also on Spotify. Thanks for joining us.